let us know when we're good to go. Good to go, Mark? Okay, good morning everybody. I'm pleased to say that we've only had 2 new cases overnight, which have been overseas acquired and are in hotel quarantine. We now have 55 active cases in Queensland, and I want to thank everyone who came out and got tested in the last 24 hours. We've had 5,308 tests. We've also had over 3,100 vaccinations yesterday, so we're now over 112,000 vaccinations. And again, I encourage Queenslanders to continue to come out and make their bookings and get their vaccinations. Sadly, I have to inform that we have had one gentleman who has died overnight from COVID, who was being cared for in our hospital system. This gentleman was from the Philippines, and I'll pass over to Dr. Young to provide a bit more detail, but we do want to pass on our condolences to his family and his friends at this really difficult time. This is another reminder that this is a deadly virus, and that we are still seeing thousands of people around the world on a daily basis dying from COVID. So this reinforces the importance of the vaccine rollout and making sure that everyone who gets the opportunity comes forward and gets their vaccine when it's available to them. I'll pass over to Dr. Young just to talk a little bit more about this gentleman. Thanks.
Thank you very much, Minister. Yes, I have some sad news to announce today. A gentleman in his 80s died late yesterday from complications from COVID-19. So he returned to Australia from the Philippines on the 20th of March, tested positive on the 25th of March, was admitted to the Prince Charles Hospital for care, and then passed away late yesterday. So that is, of course, very sad news for his family and his friends. Now, as we go forward, that reminds us of the importance of everyone, when they're able to and when the vaccine is offered to them, to go out and get vaccinated. So I'm in the over 50 age group, so I will be, as soon as I'm able to be and it's offered to me, getting the AstraZeneca vaccine. That's really important. There is the new advice going forward, of course, that anyone under 50 should preferentially be offered the Pfizer vaccine if it's available, but it doesn't stop people getting the AstraZeneca vaccine if they're under 50 and they feel that their circumstances are such that they would prefer to immediately get vaccinated rather than wait for the potential to get the Pfizer vaccine. But anyone who's 50 years of age or over, and when they're offered the vaccine, because they're in the relevant priority group, they should be vaccinated with the AstraZeneca vaccine. That's very important. And thank you to everyone who's continuing to come forward and get tested. We know that is the way to manage any outbreak, that we find the first case in an outbreak. That's very important. So please, any symptoms at all, no matter whether you think you're at risk or not of COVID, because we never know how it might get back into our community, just come forward for your own peace of mind and that you get tested as soon as possible. Thank you. Yes. Yeah. So he tested positive on day 5 on the 25th of March in hotel quarantine after returning from the Philippines via Papua New Guinea. So he transited through Papua New Guinea, but I'm sure he acquired the infection in the Philippines. Yeah, so he tested in hotel quarantine and then was moved as soon as he tested positive, as our policy is, to a hospital for ongoing management. He had been in ICU, but not when he died. In his 80s. He is 80. He's an Australian. Yes, because it was diagnosed here in Queensland. So that makes our 7th death in Queensland, and of those, one was acquired the infection in Queensland and then died in Sydney when she travelled down there for another reason. The other 5, prior to yesterday's of course, all acquired their infections on one of the many cruise ships that had cases but were diagnosed in Queensland, and then this gentleman is the 6th that has acquired their infection overseas but being diagnosed in Queensland. He was with his family. Yes. No, because everyone he was on in that flight would have gone into 14 days quarantine, and some of them may have ended up positive, and that would have all happened at the time. So there is no risk to anyone in the community from this case. I'm not going to go into the details for the family. I think they are entitled to some privacy, so they're being managed as they need to be in terms of their risks with COVID.
Dr. Young, just in terms of restrictions, if everything goes well, what restrictions do you intend to wind back on Thursday?
So we'll go back to where we were prior to these outbreaks. So if you go and look at the previous roadmap, we'll go back to that at least.
So it'll be a blanket winding back, it won't be a slow rollback of restrictions?
No, the slow rollback has happened. So we had the 3-day lockdown, and then we had some restrictions in place for a further 14 days. Then at the end of the 14 days, assuming that we hadn't had any cases, which has been the case, we would go back to where we were prior to the last outbreak. No, because we've looked into it and we can't see how that's happened, which is what we know about these new variants. They're very, very infectious. There's probably not a lot more, so they're continuing to look if there's anything, but there's probably not going to be anything more that can be found. Yeah, they've done a lot of work, so they're doing a lot more testing in Papua New Guinea, plus they're requiring them to quarantine and isolate prior to coming back to Australia. So all that's being worked through at the moment. But yes, I'm much more comfortable with where things are going in terms of both the Octedi mine and also the Newcrest and the other mines. So a lot of work's been done with all of those groups to look at how they can make it safer for their own workers, because that's actually the focus here, making it safe for their own staff. And not at the moment. No, not at the moment. No, he came from the Philippines and he transited through PNG just because they're the flights that are coming back. He's an Australian and he had been living there for a while.
Look, we've spoken at this length. The opposition are just, trying to politically point score here. Our hospitals are doing their utmost best in dealing with the surges we've seen in recent capacity for a whole range of reasons, but also dealing with our vaccinations and our testing and our COVID patients. So I'm not aware of any COGELOs today, but these hospitals manage these surge capacities. They know how to work through those and share that information across the various hospitals to make sure that we can deal with those loads. So.
Is that a merit?
ultimately, it's got to come down to health. It's got to come down to the safety of Queenslanders. And that's how we help our economy. And we've said this from day one. If we want to open up our economy, and if we are in a fortunate position to lift these restrictions on Thursday, we will be back to having some of the lowest restrictions in the country. We will be more open than most economies around the world. And that helps business. And we've seen tourism starting to pick up again, which is fantastic, through the travel around the country. What we need to do is manage the virus. The lockdown manages the virus. We wish we didn't have to do this, but the fact is when you end up with 2 clusters like we did, the best thing to do is a quick, short lockdown. And in fact, a lot of business leaders and stakeholders were saying, do it and do it quick. If it has to happen, please do it and do it quickly. And that's what we did. And it meant we could open up for Easter because we contained it and we got thousands of people into quarantine. So we know it works. We know it's world leading. We know that it's best practice to do it the way we have. We will always talk with business and support them in relation to how this impacts them. But it can't be the final decision maker. The final decision maker has to be the health advice from the Chief Health Officer. Will this help contain this virus and make sure we don't have broad community transmission? Because if we have broad community transmission, then businesses have got something to really worry about, because it will seriously damage our economy far more than we have seen so far in COVID. Look, I think it's unnecessary to be labelling it that way. I think what we saw very early on, when this sort of rhetoric, and we saw this out of the former President of the United States using that language, we saw a lot of our Asian Australians being targeted. A lot of people being targeted just because of their nationality on the streets. They were being spat on, they were being verbally abused. We don't need to go back there. We've moved on from that. We understand this is a global pandemic and we shouldn't be labelling it and targeting any particular country and potentially targeting individuals in this country. It's just unacceptable. Sorry? Look, this is around the sterilisation wraps. I have been advised and briefed by the department that we have not had to suspend any surgeries because of those wraps. This is a national issue, it's not a Queensland issue. There is supply issues with the sterilisation wraps because a lot of this material is actually being used in facial masks around the globe. So there is a global shortage. That means that various states are seeing a shortage in the supply that they have, and it's been impacted on the Suez Canal ship. So there has been impact, no doubt. But I have been briefed only a matter of days ago and advised that we do not need to suspend any elective surgery at this point. And I believe Dr. Young might be able to add to that, so I'll just ask for her to address that as well.
So at the moment, of course, we're looking at alternatives, and there are alternatives for the surgical wrap process, and that's what's been put in place. To date, Queensland hasn't had to cancel or postpone any elective surgery due to lack of the surgical wraps products, and we're just working that through, and hopefully we won't need to. Thank you.